most important things you need to consider before breast augmentation is there are two types of breast implants. There's saline, which is a salt water filled silicone shell, and then there is a silicone or cohesive gel gummy bear implant. Two different types that give you two different types of results. Another thing you need to think about is what size you want to be. Do you want to be natural? Do you want to be a little more than natural? Or do you want to be really augmented? These are the most important things you should consider. A patient that is a good candidate for a breast augmentation, meaning this is an implant placed submuscular or subglandular without having any lift at all, is a patient who has smaller breasts, a little bit of ptosis, meaning a little bit of breast sagging. So somebody who is young, does not have a lot of loose skin around the breast, or does not have a very large breast already and just looking for some cleavage in the upper area. A breast augmentation entails an incision, usually a rather small incision, in the crease underneath the breast or in the area of the areola, and some surgeons still do incisions in the armpit, the axilla. Through these small incisions, we are able to place the prosthetic usually underneath the muscle, and then if it's a saline implant, you're going to inflate it. If it's a silicone implant, it's already filled with the cohesive gel, so the result is immediate. The time for breast augmentation in the OR is roughly anywhere between 30 to 60 minutes for most surgeons. When recovering from a breast augmentation, you cannot lift anything heavy, you need to keep your arms below your shoulders, and you need to wear a surgical bra that presses the implants down that were just placed. You're going to be going through instructions about massaging your implants to make them fall down into the position that they should be while the muscle's trying to fight and pull them upwards. Recovery is a little convoluted with breast augmentation. Pain-wise, the pain you experience is typically as if you were engorged to breastfeed. This can last anywhere from 1 week to 2 weeks. The appearance of the breast takes about 1 to 2 months to recover from, as you need to inhibit the muscle from pulling up on the implant and let the implant drop down to the normal anatomical position. Your plastic surgeon is going to recommend that you do breast massage. You're going to press above the implant and towards the middle to help open the capsule up to drop the implant into the anatomical position. The pain associated with the breast augmentation is typically a pressure. Because we place the implants underneath the muscle, sometimes this pain could be perceived as a pressure on the chest. After a breast augmentation, you can usually resume exercise, heavy lifting, your normal activities around 3 to 4 weeks. Historically, plastic surgeons have told patients that your implants need to be changed out every 10 years. This is a myth. This does not hold any water nowadays. If you have a silicone implant, these implants can stay in you, I've seen 18, 20 years. The real reason to change them out is if you feel like you have a complication such as a capsular contracture or a rupture, or you just don't want them anymore. Saline implants typically will rupture or lose the fluid over time a little quicker, and they need to be changed out roughly every 10 to 15 years. I'm Dr. Boca Raton, and you can visit me at Dr. Boca Raton on Instagram or find us at straxrejuvenation.com.